What is a stroke and how does it occur?
So a stroke is it's basically an attack to the brain, and it occurs when the blood supply of the brain is interrupted. So when a blood supply to the brain is interrupted, the brain cells quickly die. The brain is a very sensitive organ, and lack of supply results in death of brain cells very suddenly. When the brain cells die, this results in major disability for patients. Stroke, as you mentioned, is a medical emergency, and something we'll talk more about later is the importance of time because, again, the brain is a very, very sensitive organ, and lack of blood supply can result ultimately in stroke and disability.
Okay, and what are the different types of stroke?
So we characterize stroke in two categories. One of them it's ischemic, which constitutes here in the U.S. about 87%, and then the other one is hemorrhagic. So ischemic, it's the majority of them, and essentially occurs when there is a blockage of a blood vessel. So we can think of it as a water pipe. Basically, when the water pipe is blocked, there is no more water flowing, the same for a stroke that it's ischemic. Now, for a hemorrhagic stroke, kind of the opposite occurs where a blood vessel ruptures. So the pipe breaks and there's spilling of the blood into the brain, and that also results in permanent injury to the brain cells. There is one subtype of the ischemic stroke, and that one is called TIA, or Transient Ischemic Attack. Essentially, it's the same process where a blood vessel gets blocked, but that's only transient. So it reopens spontaneously. Typically, patients develop symptoms of stroke, but they resolve. We now treat TIA just as we do a stroke, because if someone has had a TIA, they have a very high likelihood of having a real stroke. So sometimes we call it a pre-stroke or a mini stroke, but patients don't have a permanent deficit from that, but are very high risk.